All right, Cloudphysician, which is a full-stack AI and operations company which partners with hospitals to manage patients in their ICU and emergency departments, has raised a total of $10.5 million in a Series A round led by Peak 15. The company says this fresh capital infusion will be used to propel its growth and operations within India and expand into multiple emerging markets and established markets like the US, as well as to further enhance its AI platform, Radar. Joining me now for more on the company's plans ahead and this funding is its co-founder and CEO, Dr. Dhruv Joshi. Dr. Joshi, thank you very much for your time here and welcome to Startup Street. Before we get to the funding, give us a brief about Cloudphysician. You've partnered with more than 200 hospitals across 23 states in India. What is the gap that you're looking to solve for and the purpose with which you started the company?
Thank you, Ritu. It's a pleasure to be here. And just a quick background, I am a doctor myself. I did my MBBS here in India, following which I moved to the United States, did my specialization, and then did my super specialization in ICU medicine. So I'm an ICU doctor, and I had seen ICU care both in India and in the US. And I realized after having seen it at both ends of the world that patients who get admitted to ICUs, unfortunately, very often get shortchanged either in terms of the quality of care or in terms of the cost of getting that quality of care to them. And it is ripe for a company like Cloudphysician to build a technology-enabled solution that would address this, that would solve these two problems for patients, make high-quality ICU care more affordable for patients, right? So that's what we're doing, and we're using technology to do that. Started by solving this problem statement in the US, but then realized that this was a massive need in India. And so came back along with my co-founder, Dilip, to start Cloudphysician in India in 2017. And we've been building the solution where we convert ICUs into smart ICUs and enable the patients who get admitted to these hospitals to get better quality care, better outcomes, and to be able to get discharged quicker and faster in a more cost-effective manner.
Okay, so how do you plan to deploy this $10.5 million that you've now raised? You want to grow and expand in India as well as markets abroad. What is the plan there?
Yeah, I think what we've raised will go towards three things: to further enhancing our AI platform, Radar, that enables doctors and nurses to be able to provide better quality care to their patients. That's one. Two is we're in about 200 odd hospitals across India. There are over 50,000 hospitals that need a solution like this. And so to scale this solution across hospitals in India. And three is that we're a first mover in this space. And the problem statement that we are solving is a global one for us to expand internationally, including to markets like the US, where both me and my co-founder have spent many years. So I think these will be the three areas that we'd like to focus on in the coming months.
Well, we understand that the funds are also going to be deployed towards enhancing your AI platform, Radar. Briefly, if you could tell us about that and the solution it is providing.
So what we are building at Cloudphysician is a co-pilot, right? So what we do is we deploy our technology solution in hospital ICUs. This includes real-time video feed, computer vision, digitizing the entire workflow of a ICU. Typically, if you've ever been to a hospital, you'd imagine seeing a lot of pen and paper, just moving all that over to a paperless solution and enabling the hospital to run in a streamlined manner. That's what Radar does. In addition to this, it allows super specialist doctors to actually be at the bedside of patients, even when they're not physically there, right? It allows them to see what's happening with patients, communicate with the nurses and other doctors, and even have multidisciplinary meetings with the team at the bedside, along with families of patients as well, and help those patients get the care that they need at the time that they need it.
Well, you claim that Cloudphysician is poised to capture 10% of India's market of more than 50,000 hospitals and establish its global presence in the coming years. How do you plan to go about this, and how many more hospitals are you targeting to partner with to achieve this?
I think healthcare as an entire industry is ripe for disruption at this point in time, and technology-enabled solutions are the only way in which we are going to enable that our entire population can get the care that they need. So while it is an ambitious task that we've cut out for ourselves. We believe with the right partners, with the right team, with the best talent that there is, right from clinical to technology talent, we are well suited and well primed to expand and address this market, not just in India but across the world.
Well, before we let you go, could you give us a sense of your business model and what your current financials look like, whether that's your revenue and if you're profitable?
We have been seeing pretty rapid growth, and we are on the path to profitability. I think we have a very sound economic model in which we partner with hospitals, enable them to further enhance their revenues just by being able to be more efficient, being able to provide better care to their patients, and being able to even take on more patients, which is what is needed today. Right. The fact of the matter is that we live in a country where we have 1.5 billion people and we don't have enough hospitals for them. And we need to ensure that hospitals can actually cater to a larger number of patients. And that's what we enable.
All right, no numbers there, but thanks nonetheless, Dr. Dhruv Joshi, for joining us here on Startup Street. It was a pleasure speaking with you.